The more we learn about it, the less we know.
Their safety, of course, is our priority.
Each nurse to be competent indeed to handle a patient.
But when patients are admitted into psychiatry, patients receive different kind of treatment from the society.
Because without building the trust between a staff or a medical team and the patient, the whole process may be disturbed.
I believe that patients and family are satisfied with the quality of care we are giving.
Our training here enriched our medical knowledge, our communication skills, our professionalism. It also, they always encourage us to incorporate the new advances in evidence-based medicine in our practice. And all of these, of course, they will be reflected in a positive way in our patient care.
We have our educational activities, so we will have more to increase our clinical knowledge that is very important to our practice.
We have, for psychiatry, we have our core competencies, which we should be validated and we should be competent before we can handle the patients.
Because they are one of our educational team organized for us and is still ongoing at present. That is the therapeutic use of self in caring for patients. And the course has really benefited most of us as nurses, because though it is something that we have done in the past, but bringing it back to our memory, it facilitates our one-on-one care with our patients, and we are able to achieve better things even from our patients.
To be able to perform psychotherapy with patients, you have to get intensive training before doing this.
And also we have self-therapeutic with mental health patients, and also this is much good in course. We can use it in contacting with the patient.
In Hamad, we prioritize the patient safety when we are when delivering the care for the patients. In psychiatry, we have different trainings mandated that we have to take yearly to be able to keep us competent and continuously working with our patient together with their families.
But I think more training in this field would be very helpful for me.
I think here, especially in this area of the world, we need more training in psychotherapy because it's here they don't consider it, neither by psychiatrists nor patient, as a part of psychiatry or essential part of psychiatry. But we think it's very important for our training.
I undertook the therapeutic use of self. This is the foundation course. It was being delivered by our nurse educators. So it is foundation. So maybe if we can have additional advanced sessions, involvement of the families or the recovery, rehabilitation, it would be useful.
It will help me as a staff to identify the needs for the patients. Upon the needs and goals for the patients, so I can identify what's my pathway to work. Either it is the patient only or the patient family, or I can also put my hands where is the missing points and the weak points for the complete plan of care.
Providing mental health for the patients will be we will be one of the reasons for them to reintegrate into the community. So they will be function independently. They will be treated as equal as any human being. There will be no stigmas, no inequality. So if there will be chance for any other patient, any other people, so why they just can't give them any chance?
The training that we have in the psychiatry actually defines the difference between working in a medical hospital and a psychiatric hospital. Because unlike when you're working in a medical hospital, where patients are being admitted if they are having cancer, for surgeries, for any other medical cases, you just give them medicines, and after a few days or weeks, and kalas, the problem is solved. When they go out in the society, they will receive hugs. Congratulations, you are well. But when patients are admitted into psychiatry, patients receive different kind of treatment from the society. So the society may seem that they are useless, or that they are not functioning well, or that they are a nuisance in the society. So we need to have a specialized healthcare professionals to handle this kind of patients. And the trainings that the psychiatric department has been giving to us every year has been improving our skills in dealing with these patients and with their families.
Teamwork is essential, improving our output. Therefore, team building will give a better impact in psychiatry department.